Hello and welcome to Health Connections, your guide to healthy living and smarter choices. This October, we joined the global movement observing Breast Cancer Awareness Month, a dedicated time to raise awareness, shine a light on prevention, and support the millions of people affected by this disease. Here in the United States, breast cancer remains one of the most significant public health challenges. To understand the scale, let's look at the numbers. In 2025 alone, an estimated 316,950 women will be diagnosed with invasive breast cancer. On top of that, about 59,000 new cases of ductal carcinoma in situ, a non-invasive form of breast cancer, are also expected. Behind these sobering statistics, there's a real reason for hope. Thanks to decades of advocacy and research, outcomes continue to improve. Early detection and incredible advances in treatment have led to a steady decline in mortality rates. Still, the fight is far from over. Disparities remain a critical issue, as not all communities benefit equally from this progress. On the front lines of innovation, the U.S. Food and Drug Administration has recently greenlit powerful new therapies. For instance, Inlurio was approved for patients with ESR1 mutated metastatic breast cancer after trials showed it reduced the risk of cancer progressing by 38% compared to standard care. Another antibody drug conjugate, datopotamab deruxtecan, also gained approval this year for a difficult to treat form of metastatic hormone receptive positive HER2 negative breast cancer. And looking forward to the future, exciting research is using artificial intelligence to predict a person's 5-year breast cancer risk simply by analyzing a mammogram, potentially leading to truly personalized screening. So today, we want to discuss both the progress we've made and the path ahead. I'm honored to welcome two distinguished experts from Miami-Dade College. Professor Yolanda Nitti from the Benjamin Leon School of Nursing, whose work focuses on nursing research and patient outcomes, particularly in women's health services, and Professor Dadilia Garces from the School of Health Sciences and Physician Assistant Program. She's an epidemiology researcher and dedicated health advocate with over 25 years of medical experience. Professors Nitti and Garces, thank you for both being with us today.
Thank you.
Thank you.
Can you explain why Breast Cancer Awareness Month is so vital and how awareness campaigns translate into better outcomes at a clinical level?
Awareness campaigns save lives. Going out and educating women on early detection and having their yearly mammograms, they have an decreased mortality rate. At Miami-Dade College in the Benjamin Leon Nursing School, the nursing students go out and they actually go out and teach women about how important mammograms are each year, because that's what saves lives.
Yes, and I would like to add that they also give the opportunity to people to create more information and be self-aware that can happen in any family. That is not only touching some members of the community. Everyone is at risk that is a female. How big is that risk depends on the significant follow-up that you have and the clinical history that you can take there. Education and prevention is very important, and this is what we highlight in this month.
What are the current evidence-based screening recommendations, and how has the role of screening evolved recently?
So the low-risk patient, mammograms are usually at 40, we want them to do mammograms starting at 45 years old, but 40 years old is optional for the low-risk patients. For the high-risk patient, we normally tell them 30 years old, and when we talk about a high-risk patient, we're talking about a patient that actually has a family history or has a positive BRCA1/2 or has a family member that has a positive BRCA1/2. So those patients are now being told to do early detection, but starting at about 30 years old.
Yes, and that is crucial. And I think also part of the prevention is also the self diagnosis that you teach and train the patient how they are going to evaluate the breast monthly, because that is the early alarm that can trigger some of these tests. And overall, to keep an open communication with your provider that let know them the risk that you have, not only the genetics, also your behaviors. If you smoke, if you are taking contraceptive, if you don't do exercise, if you are obese, you are creating risk factors that are going to contribute to be a potential patient that can have breast cancer.
In terms of there's a tomosynthesis. Tomosynthesis actually is looking at dense breasts. So if a woman has dense breasts, it is best that she do a tomosynthesis test. Tomosynthesis is 3D, mammograms are 2D. The 3D is recommended for high-risk women also.
And usually we recommend the magnetic resonance or the MRI for that patients that have a specific cancers, or sometimes the ultrasound and the mammogram didn't give the complete information. Especially for the ductal cancer, you use a lot of MRIs to diagnose how invasive and how located is this type of cancer.
So many times that high-risk patient will do a mammogram and an MRI, not just one or the other. We don't just do the MRI, we do both. That's the recommendation by the American Cancer Society.
In your experience, what are the most common challenges nurses see in facilitating early diagnosis, especially in underserved populations?
So in the underserved population, the African American and very young, there's something called triple negative breast cancer, which is a breast cancer that is fast growing, and it's a breast cancer that reoccurs. Triple negative means that when they biopsy the tumor or they take out the mass, they test to see if it has estrogen, progesterone, and HER2 receptors. So these cancers have no receptors. And we have minimum, if not any drug, to actually, help these women with triple negative breast cancer, because the drugs are not available to them. They have to go into chemotherapy and some form of maybe stem cells if chemotherapy is not working. So that type of breast cancer in the African American community is very high. And like I said, if you're tested with that, there's minimum drugs that we can give them. And that is the reason that African American women usually have a high death rate for cancer, because of that triple negative that they have.
And I think the other impactful component is that part of the social determinants of health. Usually this type of population doesn't have a good insurance to cover this type of treatments that are very difficult, they are pretty expensive, and that limited the opportunity to get diagnosed on time, because they don't have the access to the health care. And when they are diagnosed and have this type of the classification that is very difficult, the treatment is not covered for the insurance that they have, or definitely is not covered. And that is this why, as Dr. Nitti mentioned, the mortality is higher in this population. When you compare with other races, these people has more access to the treatments, and the probability to survive is higher in comparison.
Once breast cancer is diagnosed, how do nurses support patients in managing the side effects of treatments such as surgery, chemotherapy, radiation, targeted therapy, or immunotherapy?
So nurses, we, of course, with the side effects, we educate with any type of therapy or any type of medication that we're actually being given when it's ordered by the doctor. Those medications have side effects, and we want to make sure that women are aware of the side effects. We also want to make them aware of the adverse effects, which is the effect that you should not have. So those are the effects that we go back and we say to them, if you have these adverse effects, we need you to go back to the physician. We also, in terms of managing the treatment, we want to make sure that they know the pros and cons. Now, we guide the patient. We're like a compass in a hurricane, okay? So we don't actually tell them what they need to do. The doctors make recommendation, but they guide the care, and we give them the pros and cons.
I think that it's important that this is the type of patient that the holistic is the word. We have to be a team. It's not only the nurses, it's the doctor, to encompass this storm that is leaving this patient, that sometimes they are the only support at home, they need to deal with life, not only with the disease, that they don't have a caregiver that is going to give them the help they are going to need, and to create that the environment that is going to be prone for the patient to really recover and restay the life. This is our mission when we work with the patient, not only with breast cancer, but any type of cancer or chronic diseases, to try to create a team that interprofessionally we try the best for our patients to have a quality of life. Because this is an important point, especially when you talk the treatments are going to have these side effects, that you're not going to have an income because you can need to be out to work. It's important that that team is cohesive, and allow the patient to navigate a very rocky sea, but in a smooth way.
We're taking a small break, but when we come back, we'll share more information about breast cancer awareness, especially when it's not restricted to women only. We'll be right back.
Are you ready to embark on your career journey at Miami-Dade College? With an impressive array of options, including 15 baccalaureate degrees and over 160 associate degrees, there's a perfect fit waiting just for you. Whether you prefer in-person, online, or hybrid classes, we've got you covered. As the largest degree-granting institution in the nation, Miami-Dade College is committed to guiding you towards success every step of the way. Discover your path with us today.
Learn and earn today at Miami-Dade College. College graduates earn 56% more than high school graduates and $1 million more in lifetime earnings. A degree from MDC is your path to greater earning power and career success. Choose from hundreds of affordable high-tech and in-demand career programs, including cybersecurity, artificial intelligence, business, and nursing. Learn and earn today at MDC and fast-track your career. Enroll now at mdc.edu/purpose.
Welcome back. How do you counsel patients and families regarding treatment decision-making, balancing benefits, risks, and quality of life?
So as nurses, before they get discharged, we counsel them throughout the hospital stay. We let them know what are the services that are available to them in the community. We make sure that they follow up with their physicians for the care. We want to make sure that families have support groups, because there's a lot of stress involved when a woman has breast cancer in the family. So we do a lot. We involve the social worker, also at the hospital, the case manager. And we talk about different things that they might be experiencing, and places they can go, how they can also have a psychiatrist if they need it, because there's a lot of issues with body image in women when they have breast cancer. So we provide emotional support as nurses. We demystify the medical terminology. We bring it down so that they understand how the care is going to be treated and what's going forward. So pretty much that's how we do that.
Yes, I was really, again, as I mentioned before, that is a team that is behind for each patient, and is tailored according with each circumstances and each diagnosis. We don't see diagnosis, we see human beings, and we try to that warm to get inside of the hospital, but get in the community too.
With new therapies emerging, how is the nurse's role shifting in monitoring adherence, patient education? Well, with new technology, a lot of nurses that are doing advanced practice and nurse practitioner getting licensure. In the curriculums in the schools, a lot of those master's degree, PhD degree, are doing courses in genetics and genomics. Those courses are being done because we're going to start counseling, and we're starting to counsel patients on how important your genetics is and how important your genomics is. It's sort of new
and AI is taking a front on that also, so that patients are more aware of what is their genetic predisposition to certain cancers, to certain chronic diseases. So that is something that now it's happening in the curriculums of many colleges. Trailblazers like Columbia University are doing a curriculum where they're including genetics and genomics, so that we can really tell the patient, what do you have and what is the near future, 5 to 10 years, that could come out. Why is the BRCA test important? The BRCA1 and the BRCA2, because that tells us in X amount of years you might be the one getting breast cancer, and can we treat that today? Can we do something about it now?
And I think in others, the new technologies, not only the artificial intelligence, also the telemedicine, is help us a lot, especially for that patients that are not live so close to cities. It's not a big Miami, probably is far away from the place that they have to go. They allow to the care providers, the nurses, the doctors, to continue to follow up. When the patient feels that you are guiding them, usually the adherence is higher, and also when they understand through the education what are the benefits of these treatments, is much better.
Survivorship is a critical phase. How do nurses help patients transition from active treatment to post-treatment life, including surveillance, psychosocial support, and managing late effects?
So survivorship is not the end of the road. Survivorship is transformation. So what do I mean by that? That during survivorship, there's a transformation, and now maybe their diet has to change. The diet is very important. Now we're telling them, we don't want you to eat too many processed food. Go for your plant-based food. So that's a transformation for some patients. In terms of the transformation, now they may have to be on certain medications like tamoxifen. Certain medications that decrease the amount of estrogen, actually it blocks the amount of estrogen, so they don't get cancer. They don't get relapse. So a lot of patients are being asked to stay on these medications for 5 years, and now the studies are calling it, they're saying 10 years. Mm-hmm. But it is a transformation of their lifestyle.
But it's also a call that they need to take care of themselves. And usually these type of survivors start to be involved with community organizations, and they become now the support of the new patients, because they represent the hope that you can do it better, that we are here for you. I know, and that empathy that is created for the path they have been building through the disease is reflected in new patients, and that is becoming one of our strongest community in relation to support. The survivors become the leaders of the new patients.
More holistic care and preventative.
Correct.
What do you see as the most promising trends or research directions in breast cancer care over the next 5 to 10 years, particularly from a nurse perspective?
From a nurse perspective, I see nursing doing more genetics and genomics and being more of those counselors, doing more genograms in their health assessments to find out what is your family prone to having, and really getting the patient connected to the help that they're going to need, so in the future they know that they're at risk for breast cancer, and that we can try to tackle that today. Other things that we're actually doing is making sure that women understand that the mammograms, if they don't have any health insurance, that they're free. Some of them are free. Breast and Health Initiative in Miami Lakes does free mammograms, as well as the Florida Department of Health. So awareness of that, so that we have, continue our survival rates. Survival rates are so good now.
Yes, and I think that it's important to start to remove the stigma. That is that if you are diagnosed, you don't have any opportunity to recover. That is a death sentence. Number one, that doesn't happen. Unfortunately, you have a new lines of medications, but also that you are alone in this, because the cost, how you are going to cover this, is great organizations, as Dr. Nitti mentioned, that are supporting this type of woman. And I would like to share, without disclosing any names, one of my students was a patient of the Breast and Heart Initiative. I diagnosed her, as we don't do that usually as professors, but she came and she told me, he diagnosed herself. She told me, I know this. And I called this organization because my student didn't have an insurance. And in less than 24 hours, a doctor was looking for her. In less than 1 week, she has all the tests, including mammogram and MRI. And when she graduates, the following day, she has the surgery completely free.
Wow.
Without to put any cents. This is the importance that we participate in our communities, because as I told my students in the physician assistant program, we plant the seed, but we never know what the shadow is going to come back to us, and has been impacting more than one student, but that was the most impressive one, because she has a very aggressive cancer and we detected on time.
That definitely goes to show how important the knowledge of how to diagnose is in yourself. Mm-hmm. Breast cancer is often exclusively discussed in the context of women. Could you shed some light on male breast cancer? How do symptoms and treatments and diagnosis differ?
So, statistically, American Cancer Society, there's 1 in 100 men who get breast cancer. Those men, a lot of them have what they call Klinefelter syndrome, which is a syndrome where they have an extra X chromosome. With that said, those men are more at risk to having breast cancer. Symptoms usually go unnoticed. They usually present a lump, but they still go unnoticed. And these men pretty much get treated late, and that's why they have a higher mortality rate. So men as well as women need to be educated in doing breast self-examinations, because, you know, it could happen, and it's not that something that cannot happen. So we basically treat men very much like we treat women, and they might be on even some of the medications, but they do, because of late diagnosis, have a higher mortality rate.
And on the other hand, sadly, our insurance are created according with the risk of the patients. And what happened, men are not seen as a risk as a breast cancer. Sometimes it's a problems with insurance to cover the treatment for males, because they are considered a risk population for that diseases. But it's more aggressive in males than in females, because they have also the testosterone that give a little push to the cancer cells to be more aggressive, okay? And males doesn't have other system to protect themselves. And the fight with insurance to try to prove that the male patient need the same treatment for a female, sometimes it's lengthy, and this is why they didn't receive also the treatment on time.
Finally, what is your message or call to action for our viewers?
My message is early detection. Make sure you get a mammogram once a year, because that is increasing survival rates. Super important.
My message will be that breast cancer awareness is only 1 month, but you need to take care of yourself the entire year, okay? Attend to your medical follow-ups, be proactive. If you have questions, ask without to be embarrassed, okay? And see for help or for guidance if you have any doubt. We need to take care of ourselves, especially women, because in our community we are the pillar of our families and a lot of things in society.
Thank you. Thank you both.
Thank you.
Thank you.
Thank you, Professor Nitty and Professor Garces, for such a thoughtful and informative discussion. Your insights into the nursing role and patient experience are invaluable. And Professor Garces, for your perspective on the research that has been truly enlightening. As we continue through Breast Cancer Awareness Month here in October, the conversation we've had today is a powerful reminder that awareness paired with action saves lives. Regular screening, following up on your results, and staying informed about new therapies, these are critical parts of the fight. So is supporting patients and their families holistically and with compassion and understanding. To our viewers here in South Florida and beyond, please make health your priority. If you or someone you love is due for a screening, or if you're experiencing any new symptoms, don't wait. Reach out to a healthcare provider and start that conversation. Information and support are available. You are not alone. Consider how each of us can make a difference, whether it's supporting vital research, encouraging a friend to book her or his appointment, or simply wearing pink to show solidarity. Every action counts. Remember, health choices lead to healthier lives. I'm Diara Roundtree. Until next time, have a healthy day.